name is Paul, and today we're going to be talking about blood pressure. Normally with blood pressure, taking blood pressure, we use a cuff that we put to measure the amount of pressure that our heart is putting into the arteries. I have a machine that'll actually do this for us. Normally, we would have a cuff with a pump that has a pressure release valve, as well as a pressure gauge of how much air is in there. And we would take a stethoscope and listen to the beats. As the pressure goes up, you won't be able to hear the beat of the heart. As you release the pressure, the very first beat that you hear is going to be your systolic pressure, which is the amount of pressure in the arteries when the heart is contracted. As you continue to release pressure, you'll continue to hear the beat. The very last beat that you hear will be your diastolic pressure. After the diastolic pressure, as you continue to release the pressure, you won't hear a beat. That is your diastolic pressure. Before you do that, you'll measure the heart rate. The heart rate and blood pressure together should be inversely related, meaning that the higher the heart rate, the lower the blood pressure should be, meaning that the pressure in the arteries is less, so the heart needs to pump more times in order to circulate the blood. As well, the lower the heart rate, the higher the blood pressure should be, meaning that the heart is able to contract with a force enough to circulate the blood, so it has to pump less in order to circulate the blood, because it has a higher stroke volume, meaning the stroke volume itself is the amount of blood that's pumped with each beat. This is just a simple machine that you can find at Walgreens or any other store that carries a pharmacy. All it is it measures the actual systolic and diastolic pressure as well, and it'll actually measure the heart rate as well. So if, for instance, you have a hearing problem or you're deaf, for instance, you can get one of these for $40. It's $10 more than what the blood pressure cuff and the stethoscope would actually cost you, as well as it's a little bit more reliable in terms of the readings. All we're going to do is press. We want our arm in an elevated position. You don't want to cross your feet. You also don't want to talk, because that will affect the reading that you get. Now, even with these machines, What I've done is I've actually placed this in an awkward position, which it's not correct. So even with these machines, if you don't set it up correctly, you'll still get an error message. It'll tell you that it can't read the blood pressure. Now, if you want to take and check the blood pressure along with the machine to make sure that the machine is actually accurate, you can. All you got to do is take your stethoscope and place it right here, right underneath where the brachial artery is, and you can actually double check. You can see the pressure reading on the actual monitor. So what you want to do is you're going to take this line where it says, and all these blood pressure cuffs have them, it says an artery mark. So you want to have the cuff for this artery mark is right here aligned with the same brachial artery that you're going to be listening to if you want to listen along with your stethoscope. Otherwise, it won't read. You won't get an accurate reading. Or you won't get a reading at all, and you'll get an error message. Now, why don't we take blood pressure standing up or laying down? The reason is that laying down or standing up, gravity actually pulls on the blood and it won't give you an accurate reading. Sitting down is the most accurate. Now what it's reading here is it says that the systolic blood pressure is actually 157 over 72, which means that the systolic pressure is actually very high. It also gives us a heart rate of 58, which means that my heart's beating at about 58 beats per second. Now, why is it that we want to look at blood pressure and heart rate? Now, again, the fact that the blood pressure is low means that the higher of systolic pressure isn't necessarily a bad thing, but it does actually throw out indicators. Now, indicators for cardiovascular disease and blood pressure are usually a systolic blood pressure of over 140, means that there is a risk for cardiovascular disease such as stroke, heart attack, hypertension. Either that, looking at systolic, or we can take a look at the diastolic pressure, where the diastolic pressure is above 90. That is an indicator that there might be something going on that you might need to take a look at.